Good morning, ladies and gentlemen, and members of the media. Let me first of all thank you for accepting our invitation to be part of this press conference organized by the Ministry of Health, Wellness and Elderly Affairs on the repurposing of the Respiratory Hospital. We have with us the Minister for Health, Wellness and Elderly Affairs, Honorable Moses Jean-Baptiste. We also have the Chief Medical Officer, Dr. Sharon Belmer-George. Also, Dr. Dexter James, the CEO of the Millennium Heights Medical Complex. And of course, next to him is a civil engineer in the Corporate Planning Unit of the Ministry of Health, Mr. Monty Emmanuel. Let me first of all make an excuse for the minister. As you would appreciate, today is his cabinet, and so immediately after his presentation, he will be seeking leave to attend to the business of the country. So first of all, I would like to call on our esteemed minister who will address us.
Thank you very much. Let me say good morning to Ms. Julita Peter. Thanks very much. And also our distinguished panel this morning, the Chief Medical Officer, Dr. Sharon Belmer-George, Dr. Dexter James, and also our civil engineer. Let me say good morning to everyone and good morning to members of the press. This press conference relates to the repurposing of the Victoria Hospital, but we also see the Respiratory Hospital. The government of St. Lucia, as part of the health sector review and reform process, has recognized the need to repurpose the Respiratory Hospital, particularly in the aftermath of the COVID-19 pandemic. Consequently, on the 20th of February 2023, the Cabinet of Ministers deliberated and provided a policy directive. Cabinet, by conclusion 110 of 2023, directed that the Victoria Hospital or the Respiratory Hospital be repurposed, and it should include the following. That 1, the Respiratory Hospital will be a multi-purpose medical facility comprising primary health services, urgent health care, and a secondary health care facility. The facility will be developed and operate under the theme, one patient, three services. That the administrative section, former accident and emergency department, the Francis Dolto building, and the area allocated to the Cuban Eye Clinic of the Respiratory Hospital are designated to be designed and operated as the Castries Urban Polyclinic. 3, that the immediate but phased transfer of the Castries Wellness Center should happen, and the Castries Wellness Center will be phased into the Castries Urban Polyclinic. 4, that the Ministry of Health should employ additional human resources in a phased way to ensure the continued operation of the facility. 5, that the operational hours of the Castries Urban Polyclinic will be as follows. All clinics, Monday to Friday, 8 a.m. to 4:30 p.m. Urgent care, every day, including Saturdays, Sundays, and holidays, from 8 a.m. to 12 midnight. The remaining sections of the Respiratory Hospital are to be managed by the Millennium Heights Medical Complex under the Millennium Heights Medical Complex Secondary Care Wing. 7, the Millennium Heights Medical Complex Secondary Care Wing and the Castries Urban Polyclinic will include an infectious disease unit and a convalescent care unit. 8, to allow for the establishment of service level agreements between the Millennium Heights Medical Complex and the Ministry of Health, Wellness and Elderly Affairs and the Castries Urban Polyclinic. 9, to implement a collaborative joint communication strategy for public education between the Ministry of Health and the Millennium Heights Medical Complex. 10, there will be the continued utilization of the space designated to the Cuban Eye Clinic under the primary health care supervision. The repurposing of the respiratory hospital was a strategy emerging from a policy directive issued by the government of St. Lucia since the year 2013. This was to be implemented following the transfer of the Victoria Hospital to the Millennium Heights Medical Complex. However, the process was delayed, and the impact of the COVID-19 pandemic made matters even worse. There was a need to review and redevelop the strategy in keeping with the government of St. Lucia's current direction for health reforms. The policy decision was preceded and guided by months of review and discussions by technical teams of both institutions. The facility will be named the Castries Multipurpose Medical Facility and will comprise the Castries Urban Polyclinic and the Millennium Heights Medical Complex Secondary Care Facility. This is an historic development within the national health sector, and it will be established and operated under the theme, One Patient, Three Services. Moi, je dis by tout gens cette ici, qui nous avons un développement qui neuf en affaires santé à cette ici. Tout le monde connaît Victoria, l'hôpital Victoria Hospital. Avec après ça, nous avons dit COVID-19, l'hôpital Victoria allait en Millennium Heights Medical Complex, ça nous a accueilli Owen King EU Hospital, avec nous changer Victoria Hospital, en disant ça, nous avons accueilli Respiratory Hospital. Ça veut dire que les gens qui ont des difficultés, qui ont l'expiration, avec expérience, ça fait COVID-19 là, c'est là, l'hôpital là, pour ça. J'ai toujours les gens qui ont difficulté à l'expiration, ils peuvent aller à ça, nous avons Respiratory Hospital, qui c'est côté Victoria Hospitalier. Le gouvernement a pris une décision pour changer ça qui a fait à Respiratory Hospital au bas côté, nous te connaître comme Victoria Hospital. Nous avons différentes facilités là à présent. Nous avons ça Castries Urban Polyclinic. Nous avons tiré Health Center, Castries à côté à présent, parce qu'elle a une difficulté à building pour Health Center. Avec nous avons fait à chaque investigation, avec nous avons Health Center pas bon qu'on y a, avec nous avons changé Health Center avec mettez Victoria, l'hôpital Victoria. Aussi, la il y a une facilité qui est opérée par Millennium Heights Medical Complex. Avec ça, nous avons en anglais Secondary Care Facility. Aussi, la il y a une facilité pour infectious disease. Avec la aussi une facilité pour ces Cubains. Vous savez, ces Cubains en clinique pour zier. Avec la il y a une facilité là pour ça aussi. Comme ça, côté à nous avons Victoria Hospital, l'hôpital Victoria. Votre vie femme là, chaque monde a dit. Mais place ça là, il y a différentes facilités avec nous voulons pour l'année clinique qui a commencé depuis 8 heures pour 4 heures et demie tous les jours, la semaine, mais les holidays avec les dimanches, les samedis, l'hôpital là est ouvert aussi pour si mon difficulté pour y aller avec nous à puis vrai que l'hôpital là est ouvert jusqu'à minuit comme ça mon cas il y a une chance pour aller là si on a une difficulté. Moi bienvenue décision ça là c'est une décision gouvernement point nous savons décision ça depuis 2013 décision ça a été faite mais il était pour un temps pour Victoria l'hôpital Victoria aller Millennium Heights Medical Complex là nous tenons COVID-19 ça a été obligé fait par force avec l'hôpital Victoria aller ça nous a créé Owen King EU Hospital. Quand ça à présent, nous avons pris une décision pour changer ces opérations qui ont été faites en Victoria Hospital. Ou bien, ça nous a créé Respiratory Hospital. Nous avons un shy meeting avec ces gens techniques là, avec aussi ces docteurs, avec ces nurses là, pour voir qui manière nous avons fait ça. Avec un budget l'année ça là, le Premier ministre a mis l'argent en budget pour nous faire ça. Comme ça, comme ministre, je suis bien content qui ça a fait et qui a aidé mon chai avec il supposé aider nous à Owen King ou l'hôpital aussi parce que toutes ces waiting à mon cas waiting en emergency accidental emergency ça kay ban nous un timide plus facile pour nous traiter mon avec l'hôpital Victoria ou bien ça nous kay kuya besoin secondary care facility ou bien Castries urban polyclinic nous kay traiter mon là parce que toutes ces moun qui ka aller à Owen King l'hôpital là il est plus facile pour nous traiter yo parce que moi bien content avec moi ça l'instant ces gens à la team là qui répondent toutes questions qui nous ni merci Achai.
Thank you, Minister. Of course, leave is granted. We know you are going back to cabinet where you will be negotiating for greater programs, initiatives in health. And of course, this press conference comes on the heels of the recent launch of the maternal and child health services under the UHC program, and that was only on the 1st of June. Let me mention that in the audience is the Permanent Secretary in the Ministry of Health, Ms. Jenny Daniel, and she's also joined by the Medical Officer of Health, Dr. Glensford Joseph. So welcome. At this time, I want to turn our attention to the Chief Medical Officer, Dr. Sharon Belmar George, who will be telling us about the services that will be provided at this new facility and, of course, the overall plan for primary health care. On to you, Dr. Belmar.
Thank you very much, Ms. Peters. Good morning to all. The Victoria Hospital was converted to the Respiratory Hospital on March 28, 2020 to facilitate the isolation of COVID-19 patients and facilitate their treatment and care. Today, 3 years later, with the reduced threat of COVID-19, reduced admissions and reduced utilization of the facility for respiratory cases, the Ministry of Health has assessed the current health services needs and advised on the best use of the facility. From January 2022, the Ministry of Health has been integrating the management of COVID-19 into the regular services. This has been done successfully with the various respiratory clinics, the COVID-19 immunization program, COVID-19 testing and reporting. The closure of the respiratory hospital is the final phase of this process. For many years now, we've noted the increasing health needs placed on the present Castries Wellness Center with the increased population numbers and urban center use. The present Castries Wellness Center structure is limited in providing the expansion that is needed at this point and for the future needs. We also note the overutilization of the emergency room of the Millennium Heights Medical Complex for non-emergency cases, leading to long waiting times and delayed care. We also noted the frequent bed shortage at the Millennium Heights Medical Complex. Presently, there is an urgent need for extended operating hours of the Castries Wellness Center up to midnight and weekends and holidays to facilitate the urgent cases with the capacity to provide basic laboratory and diagnostic services. A decision was taken by the Cabinet of Ministers to renovate, retrofit, and utilize the administration block, including the Accidents and Emergency Department, the Frontrush Dolto Building, and the section designated to the Cuban Eye Program of the Victoria Hospital as the Castries Urban Polyclinic. This process also entails the increased human resources to facilitate the extended hours of operation and increased services. As indicated earlier by the Honorable Minister, the operational hours of the Castries Urban Polyclinic to be instated will be all of the primary care clinics will be from Monday to Friday from 8 a.m. to 4 p.m. daily. The urgent care including Saturdays, Sundays, and holidays from 8 a.m. to 12 midnight. Some of the services which will be available at the Castries Urban Polyclinic will include antenatal and postnatal clinics, child health clinics, family planning clinics, cancer screening, counseling for voluntary counseling and testing, home visits, hypertensive and diabetic clinics. In addition to the basic package of services, the Castries Urban Polyclinic will provide the emergency urgent care service, as indicated earlier, up to midnight every day, minor surgical procedures, daily medical clinics from 8 to midnight, diagnostic services to include radiology, ultrasound, and laboratory, maternal child health, adolescent health, men's health, advanced screening for communicable and non-communicable diseases, physical activity and rehabilitation, reproductive health clinics, pharmacy services, eye health services, including diabetic retinopathy and laser treatment, which is presently at the Babano Wellness Center. This will be transferred to a more central location. Hearing health services, specialist clinics from visiting consultants and also in consultation with the Millennium Heights Medical Complex, daily dental services, nutrition services, mental health services, counseling services. So this facility will form a direct network with 8 level 2 health facilities and the Millennium Heights Medical Complex. At this stage, I will give a description of our present health services just to put into context what the bigger plan for primary care and the use of the services, what we are looking at, to put into context the importance of this step and to indicate where we are heading in ensuring accessible, equitable care to the entire country. At present, the physical public health infrastructure is divided into 5 levels of care, operating in 2 geographical zones. So the northern zone includes 1 level 5 facility, that is the Millennium Heights Medical Complex. Now this level 5 facility, that is the hospital, will support 2 level 4 facilities, that is the Grosile Polyclinic and the Castries Urban Polyclinic, which is coming soon. So these 2 level 4 facilities will be feeding into our level 5 facility, which is the Millennium Heights Medical Complex. Each polyclinic will provide clinical and non-clinical support to the other wellness centers that we have, which range from level 1 to level 3. The southern zone consists of the St. Jude Hospital, which supports the Dennery Hospital and the Soufrière Hospital. Our public health system has the distinct advantage of a network of 33 wellness centers situated within 3 miles of our various communities. This facilitates the provision of primary health care services, what we call preventative care island-wide. The Ministry of Health, through the Health Systems Strengthening Project, is strengthening primary care services. And this really is the most cost-effective intervention that we can do in health. So the public is advised, as always, to visit your nearest wellness center to get screened or to discuss any health concerns within the healthcare with the healthcare team. And we note this is one of the areas in healthcare that is underutilized, where we get the public going directly to your nearest wellness center. You do not need to be sick to go to your wellness center, as it says. This is for well persons to get screened, to get reviewed, to discuss any concerns, and just to get a check on your health. We really advise the public to go to your nearest wellness center on a regular basis just to get checked. You do not have to wait to be sick to go into your wellness center. So the Ministry of Health, Wellness and Elderly Affairs has done an assessment of the health needs in general. Looking at the population density, we note that some communities have grown more than others over the last few years. We've looked at the morbidity profile, that is which areas, what are the illnesses and the diseases that affect the various areas around the island, and every community is different. We do not see the same percentages of various illnesses island-wide. And we've also looked at the proximity to other healthcare facilities and hospitals and other significant infrastructure, for example, the closeness to international airports, etc. So we are working towards the establishment of strategically placed emergency or urgent care facilities with extended hours of operation to provide basic diagnostic services to improve access to timely, quality, and equitable health services. So, as we know, some of those already exist. Some of those we are working through the Health System Strengthening Project to expand what already exists. So we are looking at the Grosile Polyclinic, the Castries Urban Polyclinic, the Dennery Hospital, and Soufrière, which functions more as a polyclinic than a hospital. And we also futuristically are looking at the Viewfort Wellness Center. So these 5 facilities to provide urgent emergency care on an extended level up to midnight, some of them up to 24 hours as needed. And it will also reduce patients accessing the emergency room of hospitals for non-emergency care with the long waiting hours that we note presently exist. Centers of excellence are also being developed to provide a wider range of health services within the community wellness centers. These services will be based on the specific needs of the community that it serves. So the development and strengthening of primary care services should improve our health outcomes and also improve on access to health care and greater customer satisfaction. Thank you.
Thank you, CMO. You would have observed by now that one of the priority areas for the Ministry of Health is primary care. But notwithstanding, the ministry is also concerned about those persons requiring secondary care. And so I want to call to the lectern the CEO of the Millennium Heights Medical Complex, Dr. Dexter James, who will tell us a lot more about secondary care, and that aspect will be spearheaded by the Millennium Heights Medical Complex.
Thank you, Madam Chairperson. Pleasant good morning to my permanent secretary, senior officials from the Ministry of Health, and the media. Perhaps a good starting point for us is to place into context the development of the secondary care hospital. Our story at the Millennium Heights Medical Complex today is one in which we have challenges with respect to available beds to admit patients who cleared for admissions. On any given day, we have between 15 to 20 patients who are waiting for beds at our emergency room. Many of these patients are the uncontrolled diabetics, the hypertensives, patients presenting with cardiac problems, and perhaps the more vexing issue of the injuries from accidents and violence. All of these places tremendous burden on our limited bed capacity. We also have a number of long-stay patients waiting for palliative care and rehabilitative care that are simply just lying on beds until their conditions stabilize. In short, a lot of the NCDs, patients with diabetes and hypertension that are on our beds, are simply on diet, bed rest medication. Very little more than that. And they spend an average between 10 and 11 days. So the opening up of this secondary care hospital will provide us with an opportunity to move what we call stable and low acuity patients from the OKU hospital to the secondary care facility and thereby free up some additional beds for us. Will it solve the bed management crisis that we now have? Absolutely not. This is a longitudinal problem that will be solved only when we begin to address the question of the the epidemic with respect to NCDs. But certainly it was going to help us expand our bed capacity from what we now have. You recall that at the former Victoria hospitals, we had just about 150 beds. We're now down to 122 beds at the OKU hospital, almost 20% less. So clearly there must be a challenge. We are working collaboratively with the Ministry of Health. We're very excited about this particular multipurpose facility. For the first time, it provides us with an opportunity to seamlessly move patients across what we call the continuum of care. So a patient could present at the Castries Urban Polyclinic, we perhaps refer to the urgent center for stabilization, and if needed, be referred to either the secondary care hospital, which is on campus, or the OKU hospital. So we're happy to work with the Ministry of Health in this collaborative effort. What services will be provided at the secondary care hospital? I want to clear up the misnomer very early that the word secondary in secondary care hospital doesn't mean care to poor people or lower quality of care or substandard care. This is simply a facility that provides care to a different category of patients. And in our particular case, the category of patients are very stable, low acuity patients which can be discharged from OKU to be managed at the secondary care hospital. The facility itself will comprise of just about 30 beds. We will have, which will take care of, as I mentioned earlier on, low acuity, very stable patients. We will manage as well patients who are in a rehabilitative mode and require rehabilitative care or palliative care. We will have 2 intensive care units, as well as 2 operating theaters. Let me spend a little bit of time on the operating theaters. It is our board's policy that we want to provide an opportunity to surgeons in the private sector here in St. Lucia and elsewhere to have access to operating theater time. So it is our intention to modernize the theater to be able to offer what we call admitting privileges to our surgeons here in St. Lucia and overseas. This will provide patients, surgeons to pay for the use of the theater, admit patients to the hospital, operate on them, and then follow those patients post-operatively. In short, patients could be admitted in one of 3 ways. Firstly, the low acuity and very stable patients will be transferred from OKU hospital to the secondary care hospital. Secondly, in the unlikely event that a patient presents to the urgent center and require admission, under very strict protocol, those patients could be admitted directly to the secondary care hospital or to the OKU hospital. So in short, we will put those protocols in place to make sure that patients move, as I mentioned earlier on, seamlessly across the continuum of care, from primary to secondary to tertiary care. And finally, surgeons in the private sector can, of course, admit patients to the hospital, operate on the patients, and follow them post-operatively. We are working with the ministry in developing what we call a shared services model concept to make sure that we enjoy economies of scale and we do not seek to inflate the cost of healthcare beyond what it really should be. So in areas such as diagnostics, laboratory investigation, imaging studies, dispensing services, the manufacture of oxygen, central sterilization, these are areas where we'll share with the Ministry of Health on a shared services agreement to make sure that we do not increase the cost to the taxpayers of this country. This is what our prudent managers will do, and we are going to put that in place to make sure we keep the cost of healthcare at an affordable level to every citizen of this country. How will the facility be staffed? Well, we have existing staff at the facility who we are currently working through with the Ministry of Health to either have those staff transfer second to us so that we could use the existing staff to operate the facility. In terms of financing, as you know, the budget has been already appropriated, some $20 plus million for the respiratory hospital. Again, we're working with the ministry in transferring those funds to us so we could begin the process of remediating the wards as well as making payments to staff for payroll and other operating expenses. In another week or so, the first tranche of payment will be transmitted to Mineral Heights Medical Complex, and we'll begin the remediation works to the facility. What is the expected date for moving patients to the facility? The Mineral Heights Ministry of Health will hand over the facility in another week and a half. They will hand over to us the facilities at the Respiratory Hospital. They will hand over a set of equipment to us. They will hand over the budget line, and we hope that the transition of staff from the former Respiratory Hospital to us would be done very quickly. It is our intention that between next week and the 31st of August, we will carry on a lot of remediation works to the wards to modernize the facility so that we have a facility that is second to none. It is our intention then to move patients into that facility by September 1 this year. So by September 1st this year, we'll begin to move our full set of patients from the OKU hospital to the secondary care facility. That is as much as I want to say at this point in time, and thank you for giving us this opportunity to share this singular opportunity that the Mineral Heights Medical Complex has in being part of this Castries multipurpose medical facility with the Ministry of Health. I thank you.
Thank you, Dr. James, for providing the context within which the MHMC will be operating as far as secondary care is concerned. You will appreciate, ladies and gentlemen, that those services that have been mentioned cannot be provided within the current facility, and so, well, as is, and so some reconfiguration and retrofitting would be necessary for that to happen, and that is where Mr. Emmanuel comes in, who is our civil engineer, and so I want to hand over to Mr. Emmanuel, who will paint a clearer picture of how that will happen.
Adopting the protocol established, good morning to everybody, including the media. So Ministry of Health and Wellness is going forward with the urban polyclinic, one patient, 3 services. This is our goal, this is our vision. For the Ministry of Health and Wellness, service is what determines infrastructure. Therefore, for the services that we provide, is the infrastructure that will be required for those services. So going forward with the numerous services that we provided at our new facility, we have to now provide infrastructure and setting for those services. The building is, as we know, Old Victoria Hospital. It has many components. We have the A&E block, we have the Francis Dalton block, and we have the remaining ward areas. We also have the pediatric building, we have the nurses' home, we have the chest wing. So the sections will be allocated to various areas. So we're going to an emergency block. Well, the need, I would say, from our discussions with the team, is a larger pharmacy. I mean that the Ministry of Health does not advocate strictly medication, but a large pharmacy is required due to the numbers of persons accessing the facility, both for the medical heights and for the Ministry of Health urban polyclinic. So this is one of the major areas that will be improved, easy accessibility to medication, and that has to be set in the A&E. So the A&E will be reconstructed in a new modernized way to establish easier access, easier care. We'll be running that facility from 8 to midnight. Therefore, we have to provide the services both to staff and to the public. So The Medical Millennium Complex, as they say, will be starting the refurbishment as soon as possible because it would require to move the patients across quickly and efficiently. The Ministry of Health, on the other hand, because of our needs, we have to take a little time to refurbish our facility. Therefore, we'll be looking at starting our refurbishment as soon as possible, but with the aid of the CDB load process, will take us a little while. Therefore, we're looking at starting early September, as latest as possible, early September. The process may be sooner, but we're looking at early September. With that process, we're looking at a 10-month span for the entire refurbishment of the entire facility. Part of that refurbishment will bring in a new car park, because as you know, VH, parking is also an issue as Castries. We bring in a new car park. We will be bringing in a triage area, waiting area for patients, because the services provided at the current Victoria did not need that upsurge of people that we're going to be expecting. I mean, right now at Castries Health Center, our numbers are almost 100+ persons a day waiting. Some of us that know the conditions know people had to build additional waiting areas for persons. I would like to avoid that going forward. We'd like to put everybody in care and comfort whilst they wait. So a lot of our design and redesigning process is based on our patient care and patient delivery. So we're going to be looking at it, well, we have looked at it, I should say, in a very intrinsic manner that everybody now could be more comfortable, including staff and patient. So over the next couple of months, we'll be going through the process of redeveloping the urban polyclinic. You have to expect a newer facility. It will be moved from a respiratory to urban polyclinic, and we will be providing the additional services. I think we already started the work on a Cuban eye care so far. We've been moving forward because we already realized that the need for the Cuban eye care was down for COVID and is now in the upsurgence, so we have already started the work here. So a lot of what is required out of the Ministry of Health is ongoing and forthgoing. So therefore, we were expecting that within the next 10 months, we're going to take our phased approach. We'd like to provide the accident and emergency building first, because as Dr. Belma has stated, the accident and emergency at OKEU is filled, and we need to help them distress that level of patients waiting for hours. So therefore, that will be our first approach. Then we're going to go into the primary care aspect of it, and then the facility will then go into completion. So there's new services to be expected, there's new infrastructure to be expected, a new building is coming, a new vision is coming. So we have to expect it and wait for it and see exactly what the Ministry of Health has for us in store coming forward. So therefore, our infrastructure needs will be met, our patient needs will be met. So on that note, I thank you very much for the time to explain what we're going to be doing at the Urban Polyclinic, respiratory / old respiratory facility, the secondary care, and the Cuban eye care. Thank you.
Thank you, Mr. Emmanuel. For those of you who are of this conviction, when Christ was leaving the earth, he said, I'm going, but I leave you another comforter. And so minister has left, but he has also left behind a group of individuals who are quite able to field your questions. So at this time, I invite the members of the press to indicate whether you have any questions, but first you would state your name and the media house that you represent. So we have Mr. Emmanuel, Dr. James, and Dr. Belmar with us. If there was anything that you need clarification on, or something that you have in mind that was not said, that you think needed to be said, it is your opportunity. The floor is all yours. Perhaps our panelists did a very good job. Yes, yes, Calix?
Please stand up.
Yeah, please stand.
Good morning, all. Castries Jr., RCI. Just 4 questions, actually. I'm not sure who will answer them.
Just hold. Let me just hand you the mic. Hold on.
Hi, thanks. First is the matter of nomenclature. I mean, some people say maybe a name is not everything, and maybe a name is everything. I'm realizing there are a lot of different names being put forward in terms of the facility. Is there going to be one all-encompassing name for the facility that may be considered, especially given the concerns regarding certain words like secondary? So I think maybe I just want to get a clarification on that. Or is that something that may be changed as the project moves forward? Also, given the numbers that you also mentioned, it used to be 150 bed capacity hospital. The new facility is going to be 30 beds. Is there still excess capacity within the facility that may be utilized in the future? Also, the pharmacy, is it going to be open 7 days a week between the 8 to 12? Because I know that's a concern for a lot of people right now. A lot of pharmacies are closed on Sundays. And also, is there still consideration being given to the fifth finger at OKEU? Is that something that's still going to be looked at in terms of dealing with the need for additional bed space?
Thank you. Were your questions directed to any one individual, specific? Okay. So, okay, who would like to answer or go first?
Thank you very much. Thank you, Mr. George, for the questions. I will clear up the first question in terms of the naming. The entire facility will be called a multi-purpose medical facility. And the other section, which is the urban polyclinic, will be the Castries Urban Polyclinic. I will allow Dr. James. I think the other questions were related more to the Millennium Heights Medical Complex wards. Thank you.
Thank you, Mr. George. We are still awaiting the structural integrity of two buildings, what is called the old nursing home and the pediatrics building. Once we obtain the fit for use of those buildings, it could offer some additional opportunities for us for additional beds. Of course, major capital works are going to have to be done for the old nursing home if we're going to go in that direction. So yes, there's a possibility of expanded capacity, provided that the buildings are fit for use. The Ministry of Health is now working through getting a structural integrity report from a civil engineer, and once that report is given to us, we can then determine the way forward. As it relates to the fifth finger, no plans are afoot at this point in time for any major construction. What I would say is that we've engaged a hospital architect to look at the repurposing of existing space for additional beds for low acuity patients. We've since received that report, and our board committees will be reviewing the report to see how feasible it is to expand additional beds. We believe on campus there could be opportunities for additional bed space. We just have to become very, very creative. So we're currently looking at it right now, and we'll advise in the near future.
Okay, thank you, Dr. James. Did that answer your questions, Calix? Monty would like, okay, go ahead.
Yes, the issue, Mr. Calix, the issue of the pharmacy. The pharmacy would be open from 8 to 12 every day because it provides support not only to the urban polyclinic but also to the secondary care facility and the accident and emergency. With an accident and emergency, you will require some form of pharmaceuticals. So therefore, it will be open every day 8 to 12 to provide that service to the facility. So the pharmacy will be open to 8 to 12 every day.
Thank you. I think somebody, yes, Calix, are you done?
Well, if somebody else has a question.
Okay. In terms of transportation, I suspect we are live now on we all know now on the Ministry of Health Facebook page at NTN, and perhaps one of the questions that might be on the mind of the viewers is transportation. We know as at present, Castries Health Center is just a stone throw away, and so persons can walk. Perhaps you could tell us a bit about what arrangements are in place for transportation now that the services will be moving to the Victoria Hospital location. Go ahead, Dr. Belmar.
In our discussion for the relocation, in relation to the relocation of the Castries Wellness Center, moving over to the Old Victoria Respiratory Hospital as we know it, we did do the review of what the possible risks would be. And we know that the Castries Wellness Center, when we look at the utilization, it's used by more than just persons who live in the Castries Basin. Because it's an urban center where people work, a lot of persons who also work in Castries, and because of its accessibility by bus, we get persons from all over the island utilizing it. So one of the concerns that we did have was taking it out of the center of town to a location which is a little further away. So that is one of the risks that we did take into consideration. Presently, there is a bus route, which is the 5F, through the mall, which is already available, but in our discussion with the Minibus Association, as Mr. Bodry Ferdinand, we will be meeting with them closer to the reopening date to ensure that the number of buses that access the route will be sufficient for easy access to the facility and back. So we have already started the discussion to ensure that the present route that is already available is going to be accessible and will be easy so that we don't create an issue where persons have problems getting to the new facility as the Castries Urban Polyclinic.
Thank you, Dr. George. I think Alex has another question. Yes, please come.
Three questions again. The capital cost for the project, what do you expect to be spent on it? Also, I may have missed it regarding the services, but I know you mentioned a lot of the patients who may be coming to the secondary care facility might be dialysis patients. Is there going to be dialysis services on site offered? Especially given that, of course, it's in high demand. And I guess a follow-up to the transport question, what's going to happen in terms of the evening service, which may also be a concern for some people.
Thank you, Alex.
Okay, I'll take the minibus since I just spoke of it first. That is what our discussion with the Minibus Association will be. We've already alerted them on the plans, and there is an existing bus route, the 5F, that is already available. So we will be meeting with Mr. Ferdinand and his team closer to the reopening date to ensure that there is a regular supply of buses to and from the facility once we do reopen, because we will need transportation for the public up to midnight, which is the opening hours. So we have already commenced the dialogue, but we will be meeting with them closer to the opening date.
Dr. James, you have
all right,
something
as it relates to the capital cost, all crude estimates today, it runs at around just about $2 million. They're not really major capital works. What we intend to do is to remediate some of the wards and rooms to make them more modern. In short, is really snagging works that we will undertake over the next 2 to 3 months. In terms of dialysis services, it's not our intention at this point in time to decentralize dialysis services or to expand it anymore. What we will have at the facility is the opportunity for emergency dialysis should one of those patients that we transfer across to the facility run into renal problems or may require dialysis services as well. We would like to continue to work with the Ministry of Health in a sense, decentralizing and decompressing dialysis services at OKUH. And we'll be working with the Ministry of Health in that regard. We are also looking at other options for renal management. We haven't explored the opportunities for peritoneal dialysis, which is about 35% less than hemodialysis, and we're actively looking at that as well, where some of our more stable patients could perhaps benefit from peritoneal dialysis and thereby reduce the overall cost of hemodialysis to the population.
I guess that's it. All right.
I know you covered the capital cost for the secondary facility. I'm not sure there's
Okay. Well, for the urban polyclinic, we're looking at a slightly higher cost. We're looking at about 3.5 million. That is primarily because we have to look at redoing the entire bottom car park of the facility. We also have to provide ramped access from the car park to the facility. And since we're dealing with the Francis Bolton building and the old A&E building, our cost is a little higher, but we're looking at about 3.5 million for the reconstruction of that facility or refurbishment of that facility.
Okay, you were saying something, Doctor? All right, do we have any other questions? Okay, I suspect this is where we're going to wrap up. Let me first thank the panel for a job well done. And of course, if you're just joining us, we were joined earlier by the Minister for Health. He had to leave in order to attend to the business of cabinet. I just want to thank members of the media. I know a Monday is very busy for you with cabinet and other things happening. And for those of you who are here, thanks for coming. And of course to Miss Danielle and Dr. Joseph, thanks for coming. I want to thank the GIS team for making this press conference possible. And of course, you can look forward to more from the Ministry of Health as far as this new arrangement is concerned. Thank you, everybody.